So good morning, students. So now I'll be dealing with a topic from mental health nursing. So in that I'll be dealing with community mental health nursing. In that first we'll see what is the development of this community mental health in our country. So when we talk about this development of community mental health in our country, so it was seen that the exact treatment for this mental disorders in our country was made by the use of allopathic medicine, this use of this allopathic medicine was mainly introduced by this European rulers. Okay, it was mainly introduced by this European rurals. So that is usually what happens. So the treatment of this mental disorders in our country, it was mainly by the use of allopathic medicine, which was introduced by this European rurals. And then it was seen that the mental disorders were usually considered asadhya. Okay, it was mainly considered as asadhya by Charaka and other stalwarts. Okay, Charaka and other stalwarts of indigenous medical system. Okay, so this Charaka and other stalwarts of indigenous medical system, they considered that this mental disorders to be asadhya. This is that they will not be this like that is the treatment was not possible. Okay, the treatment was not possible for this mental disorders. And also they said that the treatment was it was usually left to the folk healers. Okay, so that is they who this mental health disorders usually was dealt or usually was taken care by this folk healers. So that is mainly these folk healers are those person who practice this art in the community setting. Okay, who practice this art in the community setting. So that is usually what happened. The institutional treatment of this mental disorders in our country was usually with the help of use of allopathic medicine, and they were usually introduced by this European rulers. Okay, it was usually introduced by this European rulers. And also the indigenous medical systems, okay, like Charaka and other stalwart, usually they consider that this mental disorders to be asadhya. So next is phases of the psychiatric services in our country. Okay, so what are the phases of the psychiatric services that is provided in our country? So that is usually there are five different phases in our country, which was usually used in this development of this psychiatric services. The first phase was usually done in the colonial period. Okay, the first phase was mainly done in this colonial period, that is before getting the independence. Okay, it was before getting the independence. So that is it was started from the 18th century onwards. Okay, it was started in the 18th century onwards, where several lunatic asylums were built. Okay, several lunatic asylums were built in different parts of the country. Okay, but several lunatic asylums were built in several parts of the country. The first mental asylum was usually established in Bombay, because the first mental asylum was usually established in Bombay, that is in the year 1745. Then in the year 1781 it was established in Calcutta. The third one was in Madras, that is in the year 1794, and the fourth one was in Bihar. So this was the asylums which was usually built during the 18th century, but these asylums were not treating the people properly. Okay, they were not treating the people properly, and the conditions in this asylum was very bad. Okay, the conditions in this asylum was very bad. So they treated the mentally ill patients as criminals. Okay, they treated these mentally ill patients as criminals. So that is usually about this thing. So the first phase of the psychiatric services was started in colonial period, that is before getting independence. So that is it was started in the 18th century onwards. So several lunatic asylums, okay, several lunatic asylums were usually built in different parts of the country. Okay, they were built in different parts of the country. The first one was in Bombay, the second one was in Calcutta, and the third one was in Madras, and the fourth one was in Bihar. But this asylums was not in good conditions. They were treating the mental patients as criminals. And then, so the inspiration for this community mental health nursing, was started in India from this sources. Okay, was started in India from this sources. So there are different sources, there are different sources about, there are three sources. Okay, they are usually about three sources. From this sources only they started with this community mental health nursing in our country. The first source is that realizing that Western countries, okay, so Western, when they saw about this Western countries where they were taking care of the mentally ill patients properly. Okay, they were taking care of this mentally ill patient properly. So therefore, from this source, from this concept, or from this thought that the Western countries are treating the mentally ill patient properly, so they also wanted to provide good treatment for the mentally ill patient in our country also. And the second source was giving training for the professionals, regarding this psychiatric. And the third source was discovering that para-professional and non-professional could deliver reasonable and mental health care, okay, could deliver reasonable and mental health care by undergoing simple and short innovative training, okay, simple and short innovative training. So these are the sources where this first source was by saying that Western country people like they are treating mentally ill patients properly, and the second source was like realizing that institution based psychiatric care can be given to the trained professionals, okay, psychiatric care, proper psychiatric care to be given to, or training should be given to the professional. And the third source was like para professionals as well as non professionals can deliver reasonable and mental health care properly, okay, can deliver reasonable by giving proper training. So this was the first phase of the psychiatric care services in our country, and the second phase was development of psychiatric services, and it was seen in the year 1950, okay, it was seen in the year 1950, where they usually given delivery of care to the proper delivery of care to the mentally ill patients. Like Nimmans was established in the year 1954 at Bangalore, okay, so they started with Nimmans, which was established in the year 1954 at Bangalore. So they were giving training to the mental health professionals, okay, they were giving training to the mental health professionals. And Nimmans was usually WHO, okay, WHO so said that Nimmans is usually a collaborating center, okay, Nimmans was usually a collaborating center for research and training in mental health, okay, for research and training in mental health since 1987, okay. So WHO has told that Nimmans, it is usually a collaborating center for research and training in mental health services. So that is usually, and they have told that it is the largest center for training center for psychiatrists, okay, it is the largest training center for psychiatrists, clinical psychologists, psychiatric social workers and psychiatric nurses in India. So it was established that like in the year 1987, WHO has told that it is this Nimmans, it is usually a collaborating center for research and training the mental health. That is, they were usually a larger center for training of psychiatrists, clinical psychologists, psychiatric social workers and psychiatric nurses in our country. And also it was seen that many mental hospitals were built in our country, okay, many mental hospitals were built in our country, such as Amritsar, Hyderabad, Srinagar, Jamnagar, New Delhi. So thus it is usually seen that, so therefore the second phase was considered that it was the establishment of many mental hospitals, okay, it was establishment as many mental hospitals. So that is, in the second phase they said that they were development of the psychiatric services, where they were concentrating on the delivery of care for this mentally ill patients. So they started with Nimmans, okay, they started with Nimmans. So this Nimmans, in the beginning it was told as All India Institute of Mental Health, okay, this Nimmans was in the beginning, it was told as All India Institute of Mental Health, and it was established in the year 1954 in Bangalore. And they were usually giving training to the people like psychiatrists, clinical psychologists, psychiatric social workers and psychiatric nurses in India. And also this, in this phase, there were establishment of many hospitals, okay, they were established with many hospitals. So next is third phase. So third phase was started in the year 1960, where they established general hospital psychiatric units, okay, here in this they started with general hospital psychiatric units. So in this usually what happened, the first general hospital for psychiatric was established in Bombay and Calcutta. That was in the year 1933, okay, that was in the year 1933. And then in the year 1970, many of such units were developed, okay, many of such units were developed. So that is usually, and in the year 1962, okay, in the year 1962, Mudliar Committee, okay, Mudliar Committee started with this establishment of this psychiatric units, okay, Mudliar Committee started with this establishment of psychiatric units. So that is usually about this thing. So and later on when it was seen that in the year 1998, except in states like Kerala, Karnataka and Tamil Nadu, majority of the country did not have such units, okay, except in states like Kerala, Karnataka and Tamil Nadu, majority of our states in our country did not have such units, okay, did not have such units. So that was in the third phase, okay, that was in the third phase. So that is third phase, it was seen that it began in the year 1960, so where they had the concept that establishment of general hospital psychiatric units, okay, establishment of general hospital psychiatric units. And this, due to this, in the year 1933, okay, in the year 1933, general hospital psychiatric units were started in Bombay and Calcutta, where in the year 1970 many of such units were established. And also it was seen that and this establishment of units was usually seen in the Mudliar Committee, okay, it was usually seen in this Mudliar Committee in the year 1962. And also in the year 1998, it was seen that all the states, like except the states such as Kerala, Karnataka, Tamil Nadu, majority of the states of the countries did not have such units. So that is usually about this third phase. So remaining phases we'll see in the next class. Next is in the fourth phase of this development of psychiatric services. So they saw that in the beginning phases I have told that they had established mental hospitals, general hospital units, and now in this phase they wanted to concentrate, or they wanted to extend the services in the primary health care centers. Okay, they want to extend the services in the primary health care services as well as in the community. So that is in the fourth phase they had seen that they wanted to extend the mental health services in the primary health centers and the community. So that is the fourth phase. It was seen that the development of the psychiatric services, which was seen in the other phases like in the mental health hospitals as well as general hospitals, in this phase they wanted to extend the services in the primary health centers and the community. And it was seen that in this phase they started up with other psychiatric societies. Okay, they started with other psychiatric societies where they conducted seminars and workshops. Okay, they started with Indian Psychiatric Society where they conducted seminars and workshops, and this was conducted, the seminars and workshops were conducted in Madurai, Trivandrum, Nagpur. Okay, so all these things. And WHO also started in the year 1971-74 they started with annual conference of this Indian Psychiatric Society. Okay, they started with annual conference of this Indian Psychiatric Society. So that is usually in this fourth phase they wanted to extend the services in the primary health care centers and community, and also they started with conducting seminars and workshops, and also they started with annual conferences. Okay, they started with addressing annual conferences in the Indian Psychiatric Society. So next in the fifth phase, okay, next was in the fifth phase, there where they started with like they wanted to develop, okay, they wanted to develop the current, or they wanted to make the some changes in the currently process, okay, the current process like development of the psychiatric hospitals, development of general hospitals, development of seminars and workshops. So all this they wanted to change, and they wanted to see that there were many series of media exposes, okay, series of media exposes about the poor and scandalous situation. Okay, so they wanted to see that media also are involved. Okay, they wanted to see that media also involved so that they can expose the conditions of the mental hospitals as well as the poor and scandalous situations that is there in many mental hospitals. And the media usually focused its attention to the rights of mentally ill. Okay, they focus on the rights of mentally ill. So that is in the fifth phase it was seen that they wanted to concentrate on the media. Okay, they wanted to pull out this, they wanted to involve this media so that they can focus on the poor and scandalous situation in the mental hospitals, like how they are giving care for the patients, whether they are giving proper care to the patients, or whether they are ill-treating the mental patients. So all these things they wanted to focus. It was mainly focused on the rights of the mentally ill and the situation of mentally ill person. Okay, situation on mentally ill person. So that is usually the different phases of development of psychiatric units. So what are the development they have seen? Substantial increase in funding and improvement in the condition of mental hospitals. Okay, so they wanted to what is the development? The first is the increasing the funds as well as to improve the condition of the mental hospitals. Then involving voluntary and non-governmental organization. Then the growth of private sector and psychiatric services, and growth of private consultant psychiatrists. Okay, so that is usually these are the development that was seen in this. That is substantial increase in funding and improvement on the conditions of many mental hospitals. Voluntary and non-governmental organization interest in development of mental health, growth of private sector in psychiatric services, and growth of private consultant psychiatrists. Okay, these are usually phases on the organization or development of psychiatric units.